Hi viewers, in this class we are going to discuss type 4 hypersensitivity reactions. These are also known as T cell mediated or delayed type of hypersensitivity reactions. Why? Because they take more than 12 hours to develop and it involves the cell mediated immune reactions to antigens. It involves the function of the T lymphocytes. This type of reaction is delayed because some time is required for the T cells to migrate and accumulate near the antigens. These T cells are called delayed type of hypersensitivity T cells. Delayed type of hypersensitivity T cells. Type 4 hypersensitivity cannot be transferred from one animal to the another by serum, but it can be transferred by T cells, particularly CD4 Th1 cells in the mice. CD4 Th1 cells in the mice. Here there is a sensitization phase where the antigen presenting cells present the antigen to CD4 cells or T helper cells, and here you can observe the differentiation of the Th1 cells and they activate the CD8 cells occasionally to cause the cytotoxicity. And here we can observe the effector phase, and Th1 cells, other T helper cells, they release IFN gamma, interferon gamma, tumor necrosis factor beta, interleukin 2, interleukin 3, and granulocyte, monocyte, colony stimulating factor, and macrophage inhibiting factor, chemokines like the IL-8 and other factors. And here there is a effects of macrophage activation through the class 2 MSC molecules. They attach to the TNF receptors. There are the free oxygen radicals and the nitric oxide. They mediate the delayed type of hypersensitivity reactions. And there are three variants of the type 4 hypersensitivity reactions which are recognized. They are contact hypersensitivity, tuberculin type of hypersensitivity, and the granulomatous hypersensitivity. Let us see one by one. Contact hypersensitivity. It is characterized by an eczematous reaction at the point of contact with an allergen. It is often seen following contact with agents such as nickel, chromate, rubber, accelerators, and pentadecocatechol found in poison. Contact with irritants that damage skin by toxic mechanisms not mediated by hypersensitivity can also produce eczema. Langerhans cells, keratinocytes have key roles in contact hypersensitivity. Keratinocytes produce a range of cytokines important to the contact hypersensitivity response. Here you can observe Th1 cells. The antigen is soluble and there is a macrophage activation, thereby release of chemokines, cytokines and cytotoxins that leads to the contact dermatitis and as well as the tuberculin reaction. Contact dermatitis. Here you can see contact dermatitis where there is involvement of the cytotoxic T lymphocytes. The effect is cytotoxicity. And coming to the tuberculin type of hypersensitivity. This was originally described by Robert Koch. He observed that if patients with tuberculosis were injected subcutaneously with a tuberculin culture filtrate, they reacted with fever and generalized sickness. An area of hardening and swelling developed at the site of injection. Tuberculin is a protein obtained from Mycobacterium tuberculosis, a bacterium causing tuberculosis. or TB. When this tuberculin is injected into the skin of a tuberculin positive individual TB patient, it causes induration, a firm and hardness and redness of skin at the site of injection. The size of the induration depends on the amount of antigen injected and the degree of hypersensitivity of the tested individual. Histoplasmin, coccidiodin, lepromin, and brucellosin are the other products of microorganisms used in the skin testing for the type 4 hypersensitivity reactions. The tuberculin skin test reaction principally involves monocytes. Here there is a delayed type of hypersensitivity reaction where if patient is infected with Mycobacterium tuberculosis, allergy to the tuberculin is development. In case of tuberculin injections into the skin of infected human, a delayed local reaction develops within 24 to 72 hours. 24 to 72 hours. It requires Th1 cells that recognize the antigen on the antigen presenting cell, and T cell releases cytokines and the chemokines. Thereby, there is a recruitment and activation of the macrophages that results in tissue damage mediated by macrophages and their lysozymes, free radicals, vasoactive amine mediators. And coming to the third one, granulomatous type of hypersensitivity, where in the granulomatous reaction, there is a balance between protective immunity and T cell, protective immunity and T cell mediated tissue damage to insoluble antigen. A good example of this is seen in the tuberculoid leprosy. Persistence of antigen leads to differentiation of macrophages to epithelioid cells and fusion to form giant cells. The whole pathological response is termed as the granulomatous reaction and it results in tissue damage. Granuloma formation is driven by T cell activation of macrophages and is dependent on tumor necrosis factor TNF. Diseases manifesting type 4 granulomatous hypersensitivity are leprosy, tuberculosis, schistosomiasis, sarcoidosis, that is enlargement of the lymph nodes, and Crohn's disease, that is chronic inflammatory disease in the ileum and the colon. So this is the granuloma formation due to the accumulation of all the giant cells, epithelioid cells, and the lymphocytes, formation of granuloma. These are about the type 4 hypersensitivity reactions. Thank you one and all.